record. Okay. So hopefully you know why you're here today, but the purpose of this meeting is to introduce the Olympic Connect data dashboards. You should have received your team's individual care coordination partner data dashboard yesterday. Can I get some nods or thumbs up or confirmation that you did get those? Okay. Those were sent to your care coordinators, the supervisors, and to your applicable leadership. And we tried to cross-reference that with anybody additional that registered for this session today. This is the first time that we're sharing those data dashboards with you. We've been hard at work with our data contractor, AHP, who I'll introduce here in a minute, to develop those for you all this year. And from this point forward, we'll be sharing those data dashboards with you every other month. You'll get your updated data. And in just another couple of weeks, you'll be getting your full year's worth of data from October 1st through September 30th of this year. So today in this time, we're going to share an overview of kind of why we have those data dashboards and how we got to this place today. We're going to ground you in what you're looking at when you open up those data dashboards. If you have two screens available, it might be helpful for you to have the Zoom open on one screen and your team's data dashboard open on the other so you can follow along. We'll have lots of opportunities for you to make sense of that data, to ask your questions to our data experts on the call today, and we'll also capture some next steps before we close. What we're not going to do today is get into the weeds on your individual data. If you feel like something looks wrong or you have a question or a concern about what's showing up in your data, happy to connect with you offline. You're welcome to email connect at, and we can set up time to individually connect with your team, but we're going to stick with grounding in what it is that we're looking at and making sure that we all have some shared understanding of what that data is. So with that, I'm going to move us into a quick breakout room where you'll have a chance to connect with two other folks on the call today. They might be other leaders, they might be other care coordinators, you'll probably be in a mix. I'd like you to introduce yourself and which organization you're from and respond to our prompt, which is what is your comfort level understanding and discussing data? So if you'll give me 30 seconds to set those breakout rooms up, I'll then send you out into space. And we'll move on from there, and you can use this time to start thinking about your response. Prompt in the chat. You're going to have about 4 minutes in your breakout room, and then it'll bring you back here. The prompt is your name, your organization, and your comfort level with discussing and understanding data. I'm going to send you into breakout rooms now.
I'm having a lot of technical issues. It seems to be working better now, though.
Hey, who's joining us with the letter E as their name?
Hey guys, this is Christine Johnson, and I'm so sorry, but I'm having some IT difficulties, and so I'm going to keep fiddling with things and just try to listen uh, and see how this goes.
No problem, Christine. I'm just going to rename you so we know who's on the line.
Yeah, I'm not sure why I have an E.
That's okay. Got you. All right, welcome back, everyone. Hopefully you were able to connect with maybe a new face, meet somebody else from one of our valued partner organizations. You might want to take a minute to put yourself back on mute because sometimes coming out of the breakout rooms, it unmutes you. Okay.
Miranda, we just started talking. Why did you end it so quickly? We were having a great conversation.
I'm sorry. I'm sorry.
It's okay.
More time to talk soon. So as I mentioned earlier, Olympic Community of Health and in partnership with Advocates for Human Potential, or AHP, have been hard at work all year developing the data dashboards. We have two different views of the Olympic Connect data to share. One is what we're talking about today, which is your individual care coordination partner data. We will only share that level of detail back directly to your team because it's your data and we want to protect your confidentiality. And we also have regional data dashboards. And we're not talking about those today, but we will at our next advisory group meeting on October 29th. So if you're eager to learn more about our regional data, then that would be the place to join us. And we have AHP coming back to the advisory group meeting in person this next time to share those with our advisory group. The data dashboards are an important way that we uplift the Olympic Connect data. We track how we're currently performing as a collective network of partners, and also track how Olympic Connect is performing to performance targets on these measures. It's an important part of how we do quality assurance to see in real time, is Olympic Connect working? Where are our successes and where are opportunities for improvement and growth? Maria, I'm going to go ahead and mute you. It's also part of our data transparency so that you all can see your own data on a regular basis, and that you feel confident in knowing how it is that we're looking at your team's data, and that you understand really well how that data is measured and shared back with you. As we look at these early data dashboards, some of the things that we're currently seeing is that month to month, probably for your team and across the region, referrals are going up. You can see that trending. Olympic Connect the word is spreading. More and more people are getting referred to Olympic Connect. Just in this last week, we've been averaging 20 new referrals a day, and that doesn't include the referrals that some of you have been trained to directly put into the system yourselves. All of those have actually been from individual community members themselves who are hearing from us through word of mouth. Either they had family and friends who have been served by Olympic Connect and had a positive experience, or they're seeing flyers posted in community spaces, and that's due to the work of your teams getting out there, hitting the pavement, and drumming up those referrals to Olympic Connect. So thank you for helping spread the word. We're also seeing those enrollments are going up. So you are proactively connecting with those referrals, sharing about what Olympic Connect is and what you have to offer, and getting those folks enrolled in our services so that they can get connected to the care that they need. Some opportunities that we're seeing in the data as we first look at it is that we need to build up our volume. Overall, we're still building caseloads. Most partners are not at maximum caseload capacity yet. And as we look to next year, we're setting some ambitious targets of doubling or tripling our current volume of clients served. We also see that there's a lot of data that's currently missing, and you're going to see that reflected in your individual team's data dashboard, as well as in the regional dashboards that we'll share at the October 29th advisory group meeting. We need some better documentation in the system on some key areas and points, and we'll talk about some of that today so that we can pull that data back out of the system. So now I'm going to turn it over to Patricia Stewart with Advocates for Human Potential. This is the time when I would invite you to pull up your own PowerPoint and follow along as she starts to ground us in the dashboards. At the outset, I want to say a huge thank you to First Step Family Support Center, who graciously volunteered to let us share and use their individual teams' data today so that we could walk through real data together as we teach you about these data dashboards. So big round of applause, please, for First Step Family Support Center for being so brave and courageous and generous in letting us share their data with you today. And you'll also give that team some kudos because you'll see from their data that they're just rocking this Olympic Connect work as well. So I'll turn it over to Patricia.
Thanks, Miranda. Hi, everyone. It's really nice to put some faces to organization names. We've been looking at and working with all of your data, but up until this moment when I got to see some faces, we were just, working with names and organization names in the system. So really nice to see all of you and get a chance to talk with you today. As Miranda said, my name's Patricia. I'm our Director of Data Collection Operations with Advocates for Human Potential. We're a national, broadly behavioral health healthcare system focused organization that does training, technical assistance, consulting, research, and evaluation. And very excited to be doing a couple of different projects with Olympic Community of Health. I grew up in Washington State. I currently live down in Vancouver. So this work is local to me and very meaningful to me as well. I also want to give Brandon Clifford a chance to introduce himself, my colleague on the project.
Sure. My name is Brandon Clifford. I'm a senior analyst statistician at Advocates for Human Potential. Patricia and I work on this together, and it's a really enjoyable time. We do a deep dive in the data. We have our processes and we're learning, but it's good to put faces to names. A little bit of context. I've been at AHP for a year and a half or so. Did my PhD at Arizona State, still in the Phoenix area, but excited to visit the Olympic Peninsula soon.
Thanks, Brandon. And then I'll also ask if Miranda can put in the chat the first step slide deck, because we're going to need that for some breakout rooms we're going to do. And then before we do those breakout rooms, just a little overview of what we'll be doing today. So we'll be showing you First Steps data, and their slide deck should reflect your slide deck. It should be the same graphs in the same order, just different data. So each care coordination partner received a slide deck with metrics specific to their organization, and you may have noticed that some graphs also show regional data for comparison. These dashboards have metrics about caseloads, resource referrals, the time from referral to first outreach and discharge, whether resource referrals are closed, and reported social and health needs. So we're going to take each of these graphs today one by one and really break them down. It's going to be very interactive, and I'll get to some of that interaction in a second. And as Miranda said earlier, it might be helpful to have your organization's slide deck open so you can follow along. So before we get into the breakout rooms, I am going to share my screen and show, just give you oriented to what's going on in the slide deck. And then when we do breakout rooms, you're going to go into 5 different breakout rooms, so slightly larger groups than we had before. And each breakout room is going to be assigned 2 graphs to look at. And the request will be to bring back 3 points to the group. And those points can be takeaways, they can be questions, or they can be a combination of the two. But just 3 things about each graph to bring back to the group. Before we get into that, I want to orient you to what's going on in the slide decks that you have. So I'm going to share my screen. Can everybody see this?
Yes.
Thanks, Brandon. And then I just gotta adjust you all so I can still see your faces. Okay. So in the slide deck today, I just want to orient you to how these are set up. So before each graph, you'll see a slide explaining what's going to be in the graph that's coming up next. It has a graph number, the graph title, and then the metrics that are in that upcoming graph. And I just wanted to make sure you're oriented to the fact that if it says, graph 1 on that first slide, then you'll see the graph 1 in the upper left-hand corner on the next slide. The graph title should be the same, and then you'll be able to look at the metrics and see what's going on in that graph. So it should be in order where you have an explanation, a graph, an explanation, a graph. Any questions about that? Okay. Any overarching questions before we do our breakout activity? Okay, so I think Miranda is going to get our 5 breakout groups set up. And in the chat, you'll see which group has which graphs. So you'll want to look for that graph number and make sure you're looking at the correct one. And we're going to be in these breakout groups for maybe 10 minutes. And you can work with your group to take a look at each graph. And we're looking at first steps graph, to be clear, or first steps slide deck. And the link is in the chat there. And my hope is for you to bring back 3 points for each graph. And then what we're going to do is give you all a chance when we get to your graph. So we're going to start with graph 1. So group 1, you'll be up first. We'll get a chance to hear your 3 points, whether that's takeaways or questions. And then we're going to start breaking down what's in that graph. I'm going to have questions for the group. You can come off mute. You can put answers in the chat. And then we'll go through how to read these different graphs and what they're saying. Is this making sense? Okay. Miranda, are we ready with the breakout groups? 1 second. Okay. Any questions while we're waiting for breakout groups? Has everyone been able to open the link that Miranda put in the chat to get first steps slides? I'm seeing nods and thumbs up. Perfect. Happy to hear that. Okay.
Okay, I am ready. Thanks for your patience. I'm going to send you out. You're going to be in 5 different breakout groups. The instructions are in the chat. So group 1 is graphs 1 and 9. Group 2 is 2 and 6. Group 3 is 3 and 10. Group 4 is 4 and 7. Group 5 is 5 and 8. And you'll know that when it sends you to your breakout room, it will tell you which group number you are in. We'll be in there for about 8 minutes, and then we'll come back as a large group.
Thanks, Miranda.
I had lost connection and just got back in, and so I don't think I got assigned a group. I don't know if you can still throw me in one or if I should just sit patiently.
No, I can. I'm going to throw you into group number 3, Christine. So you're going to be looking at graphs 3 and 10.
Okay. Okay, Miranda, I'm actually logging on a different,
Sorry.
No, it's okay. I was just saying, I'm trying to log on a different machine because I think part of it might be machine dependent. So
okay.
I'll try to be really quiet and not disruptive while I try to make this happen.
Do whatever you need to do, Christine.
Thank you.
All right, Katrina, I have to do it manually, otherwise it tries to send you and Brandon into breakout rooms. That's why
That's
it took me a second to get everything organized. I thought you would want to let them not rely on you in the group.
Yeah. Yeah, I appreciate that. I'm happy to like bounce around to groups to hear their conversations, but I don't think I can see the breakout rooms, so I don't know if I can do that.
I can make you, oh, it won't let me make you a co-host for some reason. This happened last time. Do you want me to send you into a room so you can hear?
Will I
Or
be able to leave if I want to?
you should. I made it so you can leave. You
Okay.
can return to the main session at any time. Yeah.
I should do the same thing. I feel compelled to do that.
Okay, I'm going to send Patricia to group 1 and Brandon to group 2.
All right, so we should be able to leave and then come back and see you, Miranda, and then maybe bounce around.
Yep.
Cool. All right, see you back.
Oh, I flipped it.
That's okay. I'm back.
They doing okay?
Yeah, they were quietly digesting the graphs and had a couple questions, so things are moving.
Okay. Do you want me to send you to group 3? All right. Do you want me to send you to group 3, Patricia?
Yeah, that'd be great. Thanks. They were having a great convo. I didn't want to interrupt, so I can bounce to another one. Has Brandon come back yet?
No, he hasn't. So he either got wrapped into lots of questions or is just really excited to listen.
That's fine. I can go into another one.
Let me see here. They've only got 55 seconds left, actually. Do you still want me to send you?
I'll wait.
Okay, the timer's going to bring them all back here in a minute.
Okay.
I popped out way too early. I hit the wrong button.
That's okay. Everyone's coming back in like 30 seconds, Courtney.
Thank you. I was like mid-sentence. Whoopsies.
Your group will just think you were sick of talking to them.
We honestly didn't even get to graph 9. We had some great questions around the resource referrals, like how it's getting collected and the aggregate data of it. And Brandon, poor Brandon, he got a lot of questions.
We wondered why he didn't come back. Welcome back, everyone. Again, you are unmuted as you're coming back from your breakout room.
All right. Welcome back, everybody. Is this everybody, or do we still have another group? I think this is everybody. Okay. So I'm going to share my screen with the data, and we'll be able to start with group 1 and graph 1 and hear your 3 takeaways or questions, and then we'll dive in and start to unpack things. Okay, can everybody see this? Okay, I see some thumbs up. Great. All right, let me rearrange my screen. Okay. So our first couple graphs are about caseloads and resource referrals. Graph 1 is looking at these by month, so this is not cumulative, it's just a monthly snapshot. And then graph 2 is looking at your year-to-date monthly average. So graph 1, caseload and resource referrals by month, has caseload, which is active cases for the care coordination partner by month. Some of you may notice that there might be no number label for a given month, which means that your data did not have any active cases for that month. For resource referrals, if there's no number label for a month, that means you didn't have any active cases. But if you see a 0, that's because you had active cases, but there were no resource referrals. I'm seeing some nods, so it sounds like we're understanding. Okay. All right, so group 1, 3 takeaways, questions, or a combination of the 2. Feel free to come off mute.
So is this just demonstrative, or is this aggregate data for OC of all of us?
So this is just first steps data. This whole slide deck is just first step.
But first steps, what? Is it data from all of us? Or is it made up? It's just to illustrate an example. That was the question I had, or we had.
Yeah, so in the C2C system, All of First Steps clients and activities are connected to their organization. So we download all the data and separate it out First Step, and then
First Step is the name of the organization.
yes, sorry
Not,
for that.
not familiar
Okay.
with them because you're dealing with a large geography here. So now I get it.
Okay, thank you for that clarifying question.
I thought you were talking a literal first step.
Got it. Sorry about that. First Step Family Support, yes, it's organization in the region. Great question.
I think one question that came up in our group was the definition of resource referral. What are we looking at? Is it referrals that we get in the system or referrals that are going out? And then how do we track, or do we track partners that are not in OCH? Because many people in our area are meeting their patients' goals or clients' goals with outside agencies.
Yep, those are two great questions. So the first one, the resource referrals are outgoing referrals from your organization for a client. So incoming referrals are the ones that come into Olympic Connect that then cases are assigned to different organizations, but the resource referrals are the outbound referrals from your specific organization. Does that make sense?
Yeah, and it was just interesting to see their caseloads go up and their resource referrals go down, and we had, I think 2 different interpretations in our group of why that would be. But yeah,
and I think just to follow up on the second part of his question, is there a metric for you to capture non-Olympic Connect referrals? For example, we refer quite frequently to ECHO, but they're not in the platform.
Can I jump in, Patricia? The resource referrals are not bound to whether or not an organization uses Connect to Coordinator. All resource referrals are intended to be documented in the same way within the Connect to Coordinator system, which for the care coordinators who use the system, this is the Find Resources, Make Referrals step in the workflow where you go to the resource directory, select the appropriate resource you're referring someone to, and record that within the system.
Yeah, and I think, it was Carlos, I think, who said like we had a jump in cases in our caseload, but a decline in resource referrals. It just meant they had different needs. And so maybe we were working with the 54 clients the month prior, and then we're still working with a lot of the same one and made new resource referrals. So is that it's not showing like new client resource referrals, it's showing resource referrals made in that month. So even though it goes up, we might be making more resource referrals for somebody from March in June. Does that make sense?
I think another suggestion was maybe you guys are just so awesome and you're doing all the work and don't need to refer outside and are just able to meet all of your clients' needs. Yeah.
Well, thank you. Sometimes our clients do the work themselves. It just takes, that conversation and knowing somebody's there to support you if you need it. So there's that too.
So yeah, I have a question to unpack a little more on the referrals. Miranda, if that's okay. So what is, anytime we have a metric that we're tracking, the question, that I try to ask myself at least is, what are we doing with that metric and why? What is the objective of tracking something? And so when I look at the referrals and then, how you're tracking them, that's the question I'm asking myself is there some sort of importance that you're placing on tracking the number of referrals, or is it just anecdotal? Because I think the draft language I saw for next year's funding model has a monetary incentive for referrals.
There's a couple of ways to answer your question. One, and most simply, we are required to report to our funders what are the resource referrals that Olympic Connect clients are being connected to. Two, it is one of the ways that we can identify whether or not there are resources to meet the needs of Olympic Connect clients. So if we have a lot of needs around housing, but we're not seeing resource referrals being made to housing, that helps tell a story about there might not be resource referrals existing within the community to address those specific needs. It's also another way that we start to track and develop the social care network around Olympic Connect, where we have more partners other than the 12 currently on this call, utilizing the shared regional technology to do those electronic bi-directional referrals where you can both send and receive referrals electronically. And we're not there today, but getting used to using the system for that purpose is how we start to build there. Patricia, also if you've got some questions coming in the chat.
Yeah, I was going to get to those. So the first one, in what month are resource referrals counted? For this graph, they're counted when they're opened. And then we have a closed loop resource referral metric. And for that one, they're counted in the month that they're closed. Does that answer that question?
Yeah, I guess. I'm still, I mean, I understand the requirement of the funders as, you know, the shorter answer, but I'm still not understanding beyond that. I agree we need to track it, but I'm not sure I see the full impact of tracking referrals. And the example I'll give you is we're the end stop or the end state for CARES and for most of our Jefferson County partners. And I know Wilson CARES is kind of the same in many ways, where we're actually ones that are going to fix whatever the issue is and not refer. We may refer them several times to different resources like Echo or housing or other resources, but we may not. We may have the ability to fix whatever the problem is ourselves. So it kind of, to me, it feels like when I look at the dollar amount up on this, or the number up on the screen from compare and contrast from March to July, if we use the funding model for next year, the first step's gonna be,
if not everyone has seen the funding model, so I'm gonna ask you to put that aside for the purpose of this call today. I'm happy to chat with you separately more about 2026 contracting, but not everybody has been able to look at that and digest it. So I'm going to ask you to put that aside for the rest of the call today and just focus on the purpose of the call right now, which is to understand the data that's being shared, and happy to talk about funding impacts at a separate time.
Got it. I wasn't aware of that.
Thank you. So there's also a question in the chat. Why are these two metrics together in the same graph? What's the relationship, or what are we supposed to get out of the relationship? So there's a couple of different reasons we put these in the same graph. One, it's so that you can see those two things changing together over time and be able to look at your organization and ask yourself, well, what's going on with our clients that is causing these changes to happen over time together? So I think Kelsey came off mute earlier and shared what might be going on with clients that maybe were enrolled in March and are still getting some referrals in June, or maybe some of those clients in the caseload in May, June, July already had referrals and they're still being worked with, right? So this isn't necessarily to suggest oh, your resource referrals dropped off and are super low, right? That's not necessarily the first interpretation. The interpretation has to happen within the context of your organization and how you're working with clients. Does that make sense? Okay. I thought I saw a hand raised. Was there another question?
The question was answered. Thank you. Yeah.
Okay, great. And then Miranda, there's another question in the chat about the criteria to be included in the resource directory, if you'd like to address that one.
Yeah, so Anne had asked a question about if this data is pulled from the Find Resources, Make Referrals step where you go into the resource directory. And if a resource is not in the resource directory, it is true you're not able to record that, which is why we have a system in place for you to tell us when resources are missing from the resource directory. And that's part of how we're all good stewards of that collaborative effort. And I'm not quite sure what you mean when you say criteria to be included. Our criteria is that it is a resource serving low or that's low or no cost. And our team vets all of those suggested resources to make sure that they are in fact active resources serving the Olympic Connect clientele and are provided by reputable organizations and resources. So that criteria isn't going to change, and I'm happy to hear if that causes a burden or a barrier to being able to record your resource referrals correctly.
Okay, I will double check ones that we are curious as to why they're not in there and if they've been suggested or not, or excuse me, and are not included. And then we'll also track that going forward.
I'm going to guess if you're referring to them, we want them included, and it's just that we haven't heard that they're missing yet.
Thumbs up.
Thanks, Anne. And that's another reason for these dashboards, so that we can identify those kinds of things and make sure they're getting in the system. Kelsey, go ahead.
Carlos had mentioned like maybe we're just taking care of it all internally, and some things are, but we do several different things within our organization. So when an Olympic Connect team member is connecting an Olympic Connect person, client to a resource within our agency, then we make an internal it feels a little redundant, but the care coordinator types in C2C and does a resource referral right to the other programming or department or area, if you whatever you would call it within your organization. So because the Olympic Connect care coordinator doesn't do all the things that we do, so they're connecting them with that resource. I just was wondering if that's appropriate and if other people are doing that.
Totally appropriate, and we've encouraged all of the partners to do the same. I see Dominica just confirmed Peninsula Community Health Services is doing the same because they have an interest in seeing all of those internal referrals that they're making. Some partners have chosen not to do that yet, and maybe you're planting a seed and they'll get on board.
Okay, I'm going to share one more thing about caseloads and how this is defined, and then we're going to keep moving forward. So there's a question about what does an active case mean? So your caseload for a given month is any open active cases you had during that month. So it includes a case that may have closed on the 2nd of the month, and it includes a case that may have opened on the 30th of the month. And we did that because a single snapshot in time maybe won't capture, the fluctuations and the averages in your caseload that you might be having with clients coming in and clients going out. So we wanted to make sure to include that full month to make it a more fair interpretation of what your caseload might be during that month. So that means that 58 that you see for July is all cases that were open at some point during that month. Does that make sense to folks? I see a lot of thumbs up. Awesome. Okay, I'm going to go through a couple slides, just a quick check of our understanding of this graph, and then we're going to keep moving forward. You all have had a lot of really great questions so far. Okay, so first, can someone come off mute and give me a one sentence of what this data point is telling us? Not all at once.
They had 56 active cases in the month of July, or 59. I can't read that.
Oh, it's 58. Apologies if it's a little small.
That's okay.
Yes. First, I've had a caseload of 58 clients in July. Okay, what about this one?
There were 7 resource referrals recorded in the C2C system in the month of July.
Perfect. Okay, we're going to move on to graph 2. So group 2, this is yours. So this is the same metrics, but a different time span. So caseload and resource referrals, but we're looking at the year-to-date monthly average. And then we're comparing it to the region. So for the caseload average, we're looking at that care coordination partner's average monthly caseload and the average monthly caseload across all care coordination partners for the region, and same with resource referrals. So this is just to give you a snapshot of like, what's your organization's average versus the regional average. Oh, there we go. So the caseload is over here on the left and the resource referrals are on the right. You'll also see a target for first step. So the target is going to look different in your data set. Each organization has their own target for caseloads. So you'll see the target, first steps, and then the region. There is no target for resource referrals at the moment. That's why there's no target bar there. And then you'll see the average number of resource referrals for first step per month and the average across the region. Group 2, what takeaways or questions did you have about this graph? And I see the question in the chat about how the targets are set, and maybe Miranda can answer that one in the chat. Kelsey, go ahead.
I'm wondering for the target caseload, is that first steps target caseload number or is it the regions?
That is first steps target caseload number. Every organization has their own. That's based on FTE amounts that are contracted for each partner.
Okay, thank you. That's what I was wondering.
Yeah. So if you're from a different organization, your target is probably a different number. Other questions or takeaways from group 2?
This is just a pondering with this is with kind of the inverse relationship between caseload and resource referrals for that. Just wondering if there's maybe a learning curve or kind of a process of when your caseload is heavier of how much work you're doing with each individual client or a bit of so I guess I'm wondering if the fast ramp up that we've seen might also be in relationship to how deeply we work with each individual client. And I know my team does an amazing job, but I'm curious if that impacts, documentation or whatnot. And in the long term, if that inverse relationship will prove true or if that will balance out as folks have a better understanding of the program and how it works.
Yeah, those are great ponderings. Miranda, do you have any thoughts on that?
Yeah, I think we're also curious to see how that plays out, Alicia. I think we're all aware at the outset that this is the first time you all are receiving and seeing that data. I want to kind of say very, very clearly on the call that the intention of sharing this with you right now is not to judge or make assumptions about what is happening in the data, but to more make sure we've got a collective understanding for moving forward so we can dig deeper into seeing, is it that the caseloads are impacting ability to keep up with documentation? Is there a training that we can provide to help get better documentation in place? Is it being recorded in the correct way? There's lots of things that could be at play and we just don't know yet.
Thanks, Miranda. And to Maddie's question in the chat, the target for each partner is also an average number of cases per month. Yes. So it's not your total for an entire year. So the target is what you're going for your average monthly. Okay. I'm going to keep us moving, but please feel free to keep your questions coming, at least in the chat, because if we don't get to them today, we will take a look at the chat and come back to you all with answers to those. Okay. So really quick, what can we say about First Step's average caseload compared to their target, as well as the regional average caseload?
They're shy of their target, but they're greater than the regional average.
Yes. So First Step's at about half of its target and is more than triple the average caseload for the region. What about First Step's average number of resource referrals compared to the regional average number of resource referrals?
About half as many as region.
Great, thanks, Michael. And again, the point of these exercises is to just get you looking at different parts of the graph and get you talking about the data that are in the graph comfortably. So thanks for that. Okay, and then the other thing you can be looking at is similar to that by month graph that we looked at just for First Step, where we saw the caseloads changing over month to month, and the referrals changing month to month. This is a similar metric, but it's looking at that year-to-date monthly average, right? So again, you can look at the two together. It seems like the resource referrals might be a little low, but we heard from Kelsey that there are reasons for that the organization can talk through. So you don't need to look at that and be too worried or freak out or think that something's wrong. Again, take this in the context of your organization and what's happening with your clients. Okay. We're going to move on to graphs 3 through 6. These are all about time from blank to blank. So we're looking at time from incoming referral to outreach and discharge. We're looking at the year-to-date average as well as the percentage that are happening within a certain time frame, and time from referral to first outreach as well. Okay, so graph 3. We're looking at time from referral to outreach as well as time from referral to discharge, and we're looking at the year-to-date average. So we find these numbers for every single client that your organization is serving, and then we average across all of the clients. For time from referral to first outreach, again, this is incoming referral. So they get referred into Olympic Connect and connected to your organization, and we're looking at how long does it take for your organization to have a first outreach attempt to that client. The target is for that to be within 7 days. And then similarly, the time from that incoming referral to discharge, we're looking at from the time they're first referred in, how long until they're discharged. And the target is for that to be within 6 months, though we know that there are some cases that will vary. So group 3, questions or takeaways from this graph. We've got average time from referral to first outreach on the left and average time from referral to discharge on the right. Maddie, go ahead.
So you kind of touched on this, but I want to clarify. So the one thing our group asked also was, is the referral piece when the client is created, when it's assigned to the partner, or once it's assigned to the care coordinator?
That's a great question.
Starting point of what a referral means.
Miranda, would you like to touch on this?
The referral is captured as the date the case is opened within C2C. So that would be the date the OCH team opens a case and assigns it to your organization.
Okay, awesome.
Great question. Other questions or takeaways from group 3?
I'll just say it since I'm here because our group also asked where the target of the 182 days comes from.
Thanks for that question. Go ahead, Miranda.
It's based on national trends on the community care hub models, as well as thinking through sustainability that we, again, as Patricia said, some cases will be more, and we acknowledge that. Many are less, but on average across the nation, sustainable community care hubs have average caseloads of about 6 months.
Great questions. Other questions from the group on this graph? Okay, I'm going to move on to the questions for this graph. So what can we say about First Step's average time from referral to first outreach compared to the target as well as the regional average?
They're above average.
In what way? Can you say more about that?
They're getting to their referrals quicker. It looks like to me.
Not quite. So
No?
what
I'm wrong.
this graph is, that's okay. So that's why we're doing this. I appreciate you coming off mute. So First Steps is the green bar here, and we can see that their time from referral to first outreach is taking 9.2 days. So the days are over here. Whereas the target is to be within 7 days, and the regional average is 7.1 days. So First Step's actually taking a couple days longer than the target and the regional average to do that first outreach after that incoming referral.
Does the first outreach mean you could make a call and not connect?
Yes, it is the first outreach attempt. So all of that is recorded in C2C or should be recorded in C2C, and those are the data we're pulling, and we're looking at just that first outreach attempt and the date associated with it. Okay, similarly, does someone want to tell me what the regional average time from referral to discharge is? And this is a regional average.
So they slightly longer, or about 40 days longer than average, but well less than half the target.
So what's the regional average from referral to discharge?
58 days.
That's right. Thank you, Michael. Okay, questions about that? Is everyone starting to get the hang of these two metrics? Okay. Graph 4. So this is our mean, median, and range of time from referral to discharge. So going back, that's this right-hand side of the graph. We're just looking at it in a different way. So hopefully we're all kind of familiar with mean, median, and range, but mean is the average number of days from referral to discharge. The median is the middle number of days from referral to discharge, and then we have our range. And we like to look at the median and the range so that we can see, are there outliers pulling the average in different directions? So it's, different data points, but looking at the same thing. So here's our year-to-date statistics for time from referral to discharge. We're looking at the region versus First Step. You saw the mean on the other graph, on graph 3, but we're including the median and the range here. And the range has the actual range numbers at the top, but the bar is showing the maximum. And then we have our 6-month goal here of 182 days. Okay, group 4. What are your takeaways or questions about this graph?
I'll comment that the range reflects what actually we heard from Kelsey, was that there's reflects a range in the client's needs. Some will be closed shorter time because of fewer needs or less complex needs, and some get to take longer, and that's reflected in the range.
Thanks, Michael. Other thoughts or questions from group 4? Okay. On average, did First Step meet the goal of discharging clients within 6 months? And I'd love to hear from somebody who hasn't had the chance to speak up yet. Some quiet folks on this call.
Yes. You put the graph back up to see it?
Oh, I think it's still up. Are
I
we
can
not?
still see it.
Okay.
Yes, they met their goal of 6 months.
Can you tell me how you know that?
Just looking at the graph, the 6-month goal mark here, and first up is the light green column for the range. And also down here for mean, the average days that they're with the client is 97 days, which is well below the 6-month goal.
Yes, thank you, Erica. So as Erica pointed out, we've got that line for the 6-month goal, and Erica pointed out that both their mean and their range are below that 6-month line, meaning that all of their clients were discharged within the 6-month target. But even that one client that was at 182 days was discharged within the 6-month goal. Questions about that before we continue? Okay. Compared to the regional data, is First Step discharging clients more quickly, so in less days, or more slowly, so in more days?
More slowly.
Kelsey, can you tell me why?
Regionally, the mean is 58 and the median is 50. And ours are 97 and 91.
Yes. So this is a little bit of a tricky question because the regional range is greater than First Step's range of discharge. So that's on the far right. But the mean and median are lower than First Steps, which means that on average, clients are being discharged more quickly by the region overall than by First Step. Generally, when we're asking that kind of question, we'll want to look at the mean, but I think the range can also be helpful to see that that's not true across the board for every single client. Okay, any questions about that before we continue? Okay. So graph 5 is our time from referral to outreach and discharge, but this time we're looking at it a little differently. We're trying to see what percentage is happening within a certain time frame. So before we were looking at the average number of days. Now we want to see what percent is within 7 days for time from referral to first outreach, and what percent is within 6 months for time from referral to discharge. The target for both of these is 90%. So it's important to keep that target in mind because that means that you don't need to have 100% of your clients reached out to within 7 days, and you don't need to have 100% of your clients discharged within 6 months. The target is for 90%, recognizing that there will be outliers. Okay, so very similar to the last one, we've got time from referral to first outreach on the left and time from referral to discharge on the right, and we're looking at the percent that are happening within 7 days and within 6 months. Group 5, what questions or takeaways do you have about this graph?
Yvonne, I think you were our scribe for this, yeah?
I was gonna say,
That were graph 6.
No, 5.
Oh, I wrote the wrong number down. Sorry.
No, it's good.
Alrighty. So for graph, oh, I think I looked at the wrong one. Okay. So some folks mentioned that they were looking like they were underperforming for this one. And then we also talked about, I really don't, the notes that I have is that, is there data on like the why or the barrier for the first 7 days? So does this data extract, like, does it capture why folks might be struggling to connect with folks in 7 days? I guess that's the question.
Yeah, so that's a great question. So this is about the first outreach attempt. So it's not connected with the client. It's did you attempt to outreach to the client? So the barriers to being able to do that within 7 days are something that First Step would need to discuss amongst themselves and figure out what's going on there. Why are we not able to reach out to folks within 7 days of their referral coming in? And Kelsey, I see your hand raised, so you go ahead.
We started the practice with of giving the care coordinators a 2-week time frame to make those 3 outreach attempts and good faith attempts. And then we haven't really reined that in yet. So that would explain the why behind that data. Like as soon as I read it, I was like, oh, this is why. Because we're using a 14-day time frame and not a 7.
Thanks, Kelsey. I really appreciate that.
I have something I'd like to add to we were in the graph 4 group and this kind of came up that what we were looking at wasn't necessarily a measure of success, but gives each organization a better idea of how long they're serving clients and why that might be, how long they can expect to serve clients when they enroll new ones. And it seems to be the same for this graph as well.
Thanks, Lauren. Kelsey, did you have another question or comment?
Yeah, I appreciate too how you brought up that it's like individual to our organization, we would look at it. I mean, 7 days, that's 7 days, and we work by business days. So that impacts the amount of days that we have to reach out to a client.
Absolutely.
I will also just share for Kelsey, and it's interesting that I'll share Known's data, our graph looks identical. So we got another organization, completely different size and resource, and our numbers look exactly the same. So it'd be interesting to see, why that is, but it's fascinating.
That is interesting, Michael. Thank you for sharing.
Thank you. Okay. I'm realizing that everyone had a lot of really great questions and comments, so we're about halfway through what we intended to talk through today. And so Miranda, I'd like to hear from you. How much time do you think we should continue to spend on this part today, or do you think we should plan another time? Yeah.
No, let's keep going. And if we could just end like 5-ish minutes before 12:30 so we can chat through next steps, make sure everybody knows how to get their questions answered. And then, but let's use the next 10 minutes or so to keep going.
Great. Thank you, Miranda. Okay. So a couple quick questions to make sure we're all understanding the graph. What % of First Step clients had a time from referral to first outreach within 7 days?
%51%.
That's right. So 51% of First Step clients were first outreach to within 7 days of being referred, which means that 49% of clients, their time from referral to first outreach was more than 7 days. And as we saw from the earlier slides, First Step was averaging like 9.1 or 9.2 days. So most clients are happening pretty close to that 7 days. Based on the target, how is the region doing on this time from referral to first outreach? So I see in the chat, Maddie said that they're below the goal. And that's correct. So 72% of clients across the region had a time from referral to first outreach within 7 days, which is 18% below the target. We're aiming for 90% of clients to have a time from referral to first outreach within 7 days. How is the region doing on the second metric? Which is our time from referral to discharge. I see a couple thumbs up. Does that mean we feel like the region is meeting the goal?
The region is exceeding the goal.
Exceeding the goal. Yes, the region exceeded the target, which was 90%, and the region overall has discharge happening within 6 months for 99% of clients. Any questions on this graph and the couple of metrics here before we keep going? Okay. Oh, I had one more question. Did First Step meet the target percentage for referral to discharge?
Yes.
Yes, thank you. Okay, graph 6. Time from referral to first outreach, percentage within 7 days by month. So again, this is just another way of looking at the data, breaking it down. We're taking that percent within 7 days. Instead of having your average over the whole year, we're breaking it down by month so that you can see, oh, this month we really struggled to meet that target. What might have been going on that month for our organization? So for first step, you can see their percentage of clients being outreached to within 7 days has some range, has some variety. Who had graph 6? I think this was group 2. Were you all able to get to this one in your conversation?
Not get to this one?
So this graph was assigned to group 2 to bring questions and talking points back. Were you all able to get to this one? I couldn't understand what was just said.
No, we did not have enough time
Okay.
to get to this slide.
Thank you. Sorry, I couldn't hear that the first time. Okay. Would anyone like to come off mute and talk about what they're seeing, or we can just keep moving forward if folks would like to?
I'm just curious, does the 0% mean no referrals were made in that month, or?
That's a great question. So when for across all the graphs, what we've tried to do is have no number for where there's no data. So October, November, December have no data. The 0% in July actually means that 0% of clients had their first outreach within 7 days. Does that make sense? Okay. All right, I'm going to keep this moving forward. I put these two graphs side by side, graphs 5 and 6, because they're looking at the same metric just in a different way. So we're looking at time from referral to first outreach, but the one on the left is the year-to-date average, and the one on the right is your monthly average. So when you're looking at just at first step, you can see, okay, there's a year-to-date average of 51%, and here's what it's looking like over the course of a year. So with your own graphs, I strongly recommend putting 5 and 6 side by side so that you can get the full picture of what's going on for your organization. Any questions on that one?
I'll just offer an observation that it's likely that we'll probably see a trending downward as caseloads rise. There's a greater chance that those are related. So if you, any agency starts having a higher volume, it may be harder to get to all of those calls within 7 days.
Absolutely. And there's a great question in the chat about sort of what's included in the monthly metric, which I think is a great thing for me to clarify. So part of the reason we include your year-to-date average and your monthly average is because the monthly average metric is imperfect. So for this one, we're looking at, we're only including cases that are both referred in and the first outreach attempt happens within that month. If somebody is referred in at the very end of the month and the first outreach attempt happens the next month, there's not really a way to put it on this monthly graph because then it would be going over 2 months. Is that making sense to folks? So those are not included here. That's why we also have your year-to-date average, so you're getting the bigger picture across all of your clients regardless of when it happened. Does that make sense? Okay, I'm seeing some nods. It took me a while to figure out how to talk about that one, so if you have questions later or you look at it again next week and you don't understand, please feel free to reach out. Okay, and then there's just a couple slides in here showing like these are the same type of metric, just different time frames. You all will also get a copy of this so that you can use these extra slides to break down what's happening for your organization too. Okay, we're going to talk about closed loop resource referrals really quick. So closed loop resource referrals are basically resource referrals out from your organization that have occurred that are also closed. So we're looking at this by month. Again, if there's no number label for the month, that means that the care coordination partner did not have any resource referrals for the month, so there are no resource referrals to be closed. Oh, sorry, Kelsey, did you have a question?
I was just typing it for later. I'll type it in there, and then if you're able to answer it, you can. If not, I can get it answered later.
Thanks, Kelsey. Okay. So this one's pretty straightforward. It's just the percentage of closed loop resource referrals for the month. As you can see, October, November, December didn't have any resource referrals, so there are no numbers on those months, whereas the rest of the months did have resource referrals, and that's the percentage that are closed for that month. Again, this needs to be taken or interpreted in the context of your organization. You might have a resource referral that's still open because it's taking a while to be addressed, or there's something going on with the client. And it's not a judgment, it's just to give you a piece of information about what's happening with your referrals. I'm going to keep us moving to another way to look at closed loop resource referrals, which is your year-to-date average. So similarly, we have the region compared to First Step. Of all of First Step's resource referrals for the time frame we're looking at, what percentage are closed? And First Step has 72% closed, whereas the region has 97% closed. Very similar to before. I recommend looking at these graphs side by side to get the full picture of what's going on for your organization. So graphs 8 and 7, 7 and 8, they're just 8 and 7 shown on the slides here, so that you get a better sense of what's going on. Okay, we've only got 5 minutes left. The last couple of graphs are just about social needs and health needs for clients of your organization. The one thing to say about this is that the health and social needs assessment is a living assessment, so it can change for clients over time. So it's just giving you, that's right, Miranda, I think.
Sorry, I was trying to respond to Kelsey's question in the chat, so I wasn't listening to you.
So the health and social needs assessment is a living assessment that can be updated for a client over time. Okay, so if all of your clients had this assessment updated in a month, your dashboards might look very different the next time that we give this to you. It's meant to just give you a snapshot of what's going on for your clients versus clients across the region. And these percentages are the percentage of your clients that indicated that social or health need on their assessments. Okay, I'm going to stop so that we have time to wrap up. I really appreciate y'all's engagement today as we look at these graphs together for the first time. And as Miranda said, you can email Miranda with questions, you can put questions in the chat, and we'll work together to make sure that they're addressed.
Thank you so much, Katricia. If we could just pop an emoji up to thank both AHP, Katricia and Brandon, and First Step for sharing their data with us today. Really, really appreciate that camaraderie from First Step and being willing to share their data. I also just want to reiterate that the spirit of sharing these data dashboards with you is transparency, collective growth, and understanding. So please, please, please take these in context of what the work you know that happens within your organization. It's a good starting point, and today is not the end of the conversation around data. So much more to understand, to learn together, and potentially refine as we hear what's working and where we can maybe add additional measures to the data dashboards or refine our methodology, but a good starting point. As I mentioned at the beginning of the call, you will receive your next data dashboard. You're going to get those bi-monthly. So you'll get the next one in just a couple of weeks, actually, because they'll be ready for you. And that's going to include your data from October 1st through September 30th. So a full year's worth of data. It'll look like what you were looking at today, plus August and September data. So more opportunity to kind of see how that data changes over time, as I know August and September were very busy months for everybody. And we'll be adding these to your monthly one-on-one agendas with our team for ongoing conversation. And if you have questions or feel like you would like some more time to meet and dig into your data with our team, please email the Connect Data inbox and we'll set something up with your team. Thank you so much, everyone, for your time today, and we'll talk soon.
Thanks, Miranda. Thanks, Katricia.
Thank you.
Thank you all. It's nice to meet you. All right.
Good job.
Hold on,
Folks,
let me stop recording.